Pregnancy Week 18. You are now 18 weeks into your pregnancy, nearing the halfway point. At this stage, your body adapts to your baby's growth, and you may start experiencing new symptoms that will continue for the rest of your pregnancy. Your baby's sense of hearing is developing, and signs of the baby's sex may become visible soon. Around this time, you may feel your baby move for the first time, which might be experienced as a gentle fluttering sensation. Week 18 Pregnancy Ultrasound. At 18 weeks of pregnancy, you will have an anomaly scan to check your baby's development and appearance. This mid-pregnancy ultrasound is a detailed examination of the baby's entire body to ensure proper development of major organs. It estimates the gestational age and size based on these measurements. It also examines the amniotic fluid, placenta location, fetal heart rate, and rhythm, ensuring the placenta is not lying near or over the cervix, and checks the length and closure of the cervix. Depending on your baby's position, this scan may also reveal your baby's sex, although this detail will only be shared if you want to know. If you're 18 weeks pregnant with twins, a membrane separates the two 18-week fetuses. The ultrasound can show the fetus movements and any membrane shifts. You might glimpse that adorable yawn and all those other fetal movements at your ultrasound this week. Week 18 Size of the baby. At 18 weeks pregnant, the baby is about the size of a bell pepper, measuring around 6 inches long and weighing about 5.5 ounces. Week 18 Baby's development. At 18 weeks, the baby's bones start to harden through ossification. The digestive system is developing, and the baby swallows amniotic fluid, which combines with dead cells and secretions in the intestines to form meconium. Gender-specific developments occur, such as the formation of the uterus and fallopian tubes for girls and the visibility of genitals for boys. The baby's ears, nose, lips, eyelids, eyebrows, eyelashes, nails, and hair are formed, and the respiratory system develops. The nervous system creates more complex connections, and the baby is active, practicing various movements like yawning, hiccuping, sucking, swallowing, twisting, rolling, punching, and kicking. The baby is developing a light coating of hair called lanugo, and their eyes are now facing forward. The baby's ears are beginning to stand out and may start registering sounds. Week 18 Pregnancy Belly. At this stage of your pregnancy, you will likely have a noticeable pregnant appearance as your baby and uterus are growing rapidly. However, it's important to remember that every woman's pregnancy is unique, so the size of your bump may differ from others. Bumps are normal and vary based on weight gain, height, build, and whether this is your first pregnancy. Your uterus will continue to expand and grow, which may affect your balance and center of gravity. First-time mothers may start feeling the baby move inside the belly, known as quickening, around this time. As your baby grows, you may notice stronger movements and even kicks. However, every expectant mother is different, so the timing of these movements can vary. There's no need to worry if you don't feel any baby movements at 18 weeks pregnant. Week 18 Pregnancy Body Changes. During the 18th week of pregnancy, you may experience back pain as your growing uterus shifts your center of gravity, pulling your lower back forward and thrusting out your abdomen. You may also experience changes in circulation, such as increased blood volume and rapidly expanding blood vessels, which can cause your blood pressure to drop. This may leave you feeling lightheaded if you're not getting enough blood flow to your head and upper body. Swelling in your feet due to water retention, known as edema, may also occur. It's important to be mindful of weight gain and focus on maintaining a healthy diet for your well-being and that of your baby. Week 18 Pregnancy Symptoms. Varicose veins. These are enlarged, twisted veins that often appear on the legs and can cause discomfort. Stretch marks. Stretch marks may start to appear as the abdomen, breasts, and thighs expand. Round ligament pain. As the ligaments supporting your uterus stretch, you may experience sharp pains in your lower abdomen. Nosebleeds. Hormonal changes and increased blood volume can cause your mucous membranes to swell, leading to nosebleeds. Vivid dreams. Many women report having more vivid or strange dreams around this stage of pregnancy, possibly due to hormone fluctuations and disrupted sleep. Heartburn and indigestion. You might experience heartburn and indigestion, especially after consuming spicy or large meals. Itchy skin. Your skin may feel itchy, particularly around your belly as it stretches to accommodate your growing baby. Increased appetite. You may find yourself feeling hungrier than usual as your body works to support your growing baby. Vaginal infections. Changes in vaginal pH and hormone levels can increase the risk of infections. Leg cramps. These can become more frequent, particularly at night, often caused by changes in circulation and pressure on nerves. Week 18 Pregnancy Checklist. Many insurance plans cover the cost of a breast pump, so it's a good idea to explore your options and find the best one for your needs. Make a list of foods high in omega-3 fatty acids and add them to your weekly shopping list to support your baby's development. Start thinking about names for your little one and discuss them with your partner. Start collecting books to read to your baby, as it's never too early to begin this bonding experience. Start considering your maternity leave plans and communicate with your employer about your options. Sign up for birth classes to prepare for the delivery and gain valuable knowledge about the process. Take the time to read up on what to expect during the mid-pregnancy ultrasound to alleviate any concerns or anxiety. Check your desk chair for comfort and consider using a more supportive chair or a footstool to alleviate back pain. Take advantage of this honeymoon stage of pregnancy and plan a date night to maintain intimacy with your partner. Consider signing up for infant CPR, prenatal breastfeeding, or newborn care classes to gain essential skills for caring for your baby. Start planning for the financial aspects of having a baby, including budgeting for additional expenses. As your due date approaches, involve and prepare your older children for the upcoming changes and ensure you have arrangements in place for their care during the birth. Start preparing your pet for the new addition to the family early in your pregnancy or before conception. Start creating a baby registry to organize and list the items you'll need for your baby. Start planning your baby shower or communicate your preferences to the person organizing it. Week 18 Pregnancy Tips. If you're experiencing edema or swelling, invest in support hoses or compression socks to alleviate discomfort. Be cautious in the shower and ensure no tripping hazards in the hallways. Also, avoid standing on chairs to prevent accidents. Opt for comfortable and supportive shoes to minimize foot or ankle discomfort. Gradually increase your fiber intake to help with any digestive issues you may be experiencing. Elevate your legs to prevent or alleviate leg cramps, especially at night. Start sleeping on your side, preferably the left side, to promote better blood and nutrient flow to the placenta and baby. Start moisturizing your belly to help prevent stretch marks as your body changes. Start practicing Kegel exercises to strengthen your pelvic floor muscles, which can help with bladder control and postpartum recovery. For more videos like this, please like, share and subscribe.